vaginal hormones have been proven over and over and over again to prevent urinary tract infections by way more than half. I mean, there's data going back to the 1990s. The fact that it's a marketing issue. This is why I go on social media, because it's not safety, it's not efficacy, it's not a cost anymore. It used to be cost, it's not cost anymore. It's just marketing. People don't know they need this. Why would they use something that they don't understand and they don't know that they need? So again, lady in a nursing home will die of a urinary tract infection. It will go, her brain, she will become delirious, and she will go to the intensive care unit with sepsis. Happens all day, every day. Okay. Vaginal hormones can prevent that from ever needing to happen.
Please hear this, everyone. This is so critical. I'm thinking of somebody, I don't mean to interrupt you, but I'm thinking of somebody who asked me yesterday ahead of knowing we were having this conversation, and she said, really, vaginal estrogen does all of that? Really? And I want you to speak to that person for a second.
Well, so that's what's so crazy is like it seems like it's too good to be true, and it's true. And that's what's so infuriating about it. It's so infuriating because you don't need to spend thousands of dollars on lasers. You don't need to spend thousands of dollars on probiotics and vajazzling things and all these things. Like vaginal hormones fix the problem, and most insurances cover it. It is affordable now. It didn't used to be. When I came out of my residency, a tube of estrogen was $500. So again, this kills people. Like it's very serious. The other thing, we had a big event last night. Everybody should sign up for our newsletter, by the way, at rachelrubinmd.com. But we had a big event last night where 50 women showed up. We brought in an osteoporosis specialist, and we're talking about weightlifting and bone health. It was so much fun. But the problem is that women get up in the middle of the night because they have to pee, and they break their hips and they die. If you break a hip, you have a 30% chance of dying that year. And so you have to understand that your urinary health is like literally your life, your health. This is the difference between living and dying potentially. So but the problem is these products are FDA approved for dyspareunia, pain with sex. I'm a sex doctor. I'll talk about sex all day long, but I actually think the more important issue here is urination and UTI prevention, not sex. Yes, you get the sex benefits, but these products are urinary life-saving bladder medications.
Fantastic. I'm going to segue us for the last 5 minutes before we start with viewer questions on kind of like a vaginal estrogen fact fiction.
Yeah.
Bang, bang, bang. You answered some of these already, but I really want to drill these home. Fact or fiction, I can use vaginal estrogen forever.
And ever, and ever, and ever, till death do you part.
May I also ask you to piggyback off of that? When might you suggest someone start?
So I'm very aggressive. There's no right answer here. Certainly if you have any urinary symptoms, frequency, urgency, leakage, getting up at night to pee, any UTI symptoms, any pain with sex, any dryness, yes, you should be on vaginal hormones. I believe strongly in prevention. I never want you having symptoms, and there is no danger to vaginal hormones. So we'll use them in people in their 30s. I'll use them in people in their 20s because you're not adding any risk. You're not adding any problems. And the tissue, it's like you can't overwater a plant. It's right. Like you're watering, you're not going to make a plant grow, into a giant tree.
Right.
You give it the amount that it needs. And so if you are already having lots of estrogen in your body and you add a little bit more locally, you may help, but you're not going to hurt. You're not going to overdo it or something like that. So there's nobody,
that's a great,
you can't overdo it really. I mean, so again, the overdo it. So if you're using a dose that's too high, then we do worry about whole body absorption. But if you use the correct dose, you can't overdo it, if that makes sense.
It does make sense. And it was one of my fact versus fiction questions. If you're taking oral estrogen or using a patch, vaginal estrogen is not overkill.
It's actually almost always necessary. We don't have a perfect number for this, but I will tell you, for some reason, the pills and the patches for many people do not fully fix the local symptoms. So if you're on a patch or a pill and you still have any symptom of urinary frequency, urgency, leakage, dryness, pain with sex, adding vaginal hormones is a must. It doesn't increase.
I am one of those people.
Most people.
Yeah.
And so it doesn't add any risk. It doesn't add any, it actually doesn't make your patch a higher dose, because it's just local.